Folks, what we're going to do today is show you the use of our ASTYM tools, that stands for Augmented Soft Tissue Mobilization. We got trained in this on Derby Day of 1999, so we just had the Derby, and so that's 17 years. And we use it not only just on shoulders, but for people that have maybe neck problems, back problems, post-operative for back or neck to relieve scar tissue. And this demonstration is just for severe tendonitis that has taken this gentleman out for a while because the pain shuts muscles down. He can't sleep on it, can't raise it over his head, and he has found a great deal of relief with using the ASTYM tools on him. And so we're going to have one of our therapists who's been trained for 17 years show you how we do that. He's using the tool called the evaluator, and these tools were made up at Purdue University because we had to find out what resonated with the body, muscles, tendons, ligaments, and of course the skin, and underneath the skin is fascia. And with doing that, we're able to use vibration to break down any of the tendinitises, any of the fibrosis or scar tissue, and let the body take over and start healing itself. So Dr. Tom Severe founded this many years ago when he was the team physician for Ball State University. As a sports medicine doctor, the coaches were coming to him and saying, "Look, doc, you're keeping our kids out too long. You got to find a way to get them to heal up faster." And so he started off with stainless steel tools, but it was too hard on the patient and the therapist to use those tools. So he went to Purdue, and the rest is history, as they say. We have a very large database there from all around this country and other parts of the world of people that have been trained in the use of this. And since we've been using these tools, it's been nothing short of phenomenal. And we use them on people that have plantar fasciitis. And it's almost a guarantee we break up all of that itis in there and get them orthotics that they're going to be 100% cured. We use them at the knee for people who've had total knees, so the scar tissue doesn't bind them down and keep them from flexing their knees. We use them on every area of the body, and it's just been an incredible tool to help people to jumpstart their healing. As soon as we lay the tools on them, even after a fresh injury, it jumpstarts their healing. And so we're very thankful to Dr. Severe and all of his people, his great trainers that have taught us how to use these, and for their collection of data over the years, so we know exactly how to use the tools. And we use them no more than 10 visits, and usually we can have someone much better in 5 to 6 visits. But that doesn't mean we'll cut them off unless there is no fibrosis left, scar tissue or pain. And then we'll stop at 4, 5, or 6, but there's no more than 10 treatments. And the great thing Dr. Severe has found out from all of his collection of information is that once we clear that body of its itis, it doesn't come back. So it's a win-win situation. The patient can feel the problem as same as the therapist, and they can feel it as it gets better. So we just wanted to bring you the information about ASTYM today because we're the only ones in the tri-state that have been trained to do this, and it's been for 17 years, and we just have a problem that we don't get out and tell everybody, and so this is one way that we can communicate with all of you.